welcome to Dr. Kishore Babu.
Very good afternoon. I'm not going to speak much about rhinoplasty. I'm only going to speak about surgical genioplasty. The topic is genioplasty as an adjunct to rhinoplasty. I'm going to run my slides a little quicker. Okay, I'm basically going to speak about the way I do my genioplasty as a complementary procedure for rhinoplasty. Genioplasty and rhinoplasty are complementary procedures that can be performed simultaneously to improve the facial balance and harmony. Patients seeking cosmetic rhinoplasty may not be aware of chin dynamics. Careful pre-op evaluation of full facial profile should be performed on a potential rhinoplasty patient. The relationship between the nose and the chin is a common error in the pre-op evaluation of rhinoplasty. Evidence shows that a significant number of patients requesting rhinoplasty present with mild and low face dysmorphia. A recessive chin, performant lower lip, exaggerated labiodental angle, diminished or increased facial height are most frequent features that can be observed in pre-rhinoplasty patient. This slide is very important. Please, this very important slide. I'm not going to go into the depth of invention of genioplasty. You can see the picture. Usually, this is the main difference between the male and the female chin. Male usually have a squarish chin and is very prominent, whereas in females, the chin is usually narrow and rounded. This is a small diagrammatic representation of how the male and female chin looks. Well, there are many classifications for genioplasty. It is very simple. Just remember as reduction genioplasty and augmentation genioplasty. Reduction means you are going to set back genial segment chin backward on a people with most procumbent chin. Augmentation, which is called as we also call as enhancement genioplasty. So which we do in the recessive chin. So this is how I perform my genioplasty. Usually I use most of the times only local anesthesia with mild IV sedation. The internal initiation is placed in front of the picogingival junction. We are going to expose the chin up to the lower border along with the periosteum. Then we mount the osteotomy sites. Then we do the osteotomy cuts. All these things I am going to show in the next videos. Then we are going to do the bone fixation with 2 mm titanium plates and screws. Next step is very important, which is mentalis muscle repositioning. If you don't do the mentalis muscle repositioning properly, then you will definitely have a totic chin. The chin will drop down. Then the mucosal pressure, I usually use 501 drill followed by chin compression, bandage for firstly the edema. Suturing is usually done with an observable suture. These are the routine tests. Routine blood tests is pre-op. Radiographs I just ask my patient to get the OPG and let his angiogram done. What are the technical difficulties in performing genioplasty? The access is very less. It's very difficult in controlling the bleeding. Prolonged edema after surgery requires experience and expertise in performing such procedures. These are the usually general complications which we come across following genioplasty. There is mental nerve damage, which could be permanent, temporary numbness of the chin for few months, the facial asymmetry, lip incompetence, that means the upper and lower lip doesn't meet, liptosis, which is nothing but sagging of the lower lip, exposure of the lower incisor. This is also very important. The most of the people will have exposure of the lower incisors following the chin implant. When you do a chin implant, most of the patient will come across it. Then the prolonged edema, obviously, then the lower face sagging in elder people. So when you perform a genioplasty in elder people, it's always better. You could tell the patient that they are going to do a adjunct neck and a little bit of low face neck as well. The precautions, these are the things which you need to do following the rhinoplasty. When you perform the rhinoplasty, expose and isolate the metal nerve. In fact, the metal artery as well. achieve good hemostasis before closure. The meta is muscle repositioning to prevent liptosis. Then the lip components of the lower face asymmetry. Adjunct face and neck lift should be performed. Post-op care, pressure dressing for a week, antibiotics and pain meds and mouthwashes for a week. Stop the liquid diet for 2 weeks. You can ask the patients to sleep upright with 2 soft pillows below the head. No strenuous exercise for a month. Ice application for few days. The summary and conclusion. Genioplasty complements rhinoplasty. So proper pre-op evaluation of all the patients seeking rhinoplasty should be done by rhinoplasty surgeons. Without addressing a retrograde or a over-protruded or a deformed chin and performing an isolated rhinoplasty may not yield the optimal results and outcomes because of compromising aesthetic balance, facial profile, facial harmony, and patient satisfaction. Which I need to say that most of the patients will be dissatisfied. In my experience, almost 50 to 20% of the patients, potential rhinoplasty patients, I do perform genioplasty as well. It is only the surgical aspect. This is my translator from India. Before, this is after. We have performed the chin rhinoplasty. Multiple procedures have been performed, but here I am only talking about the nose and the chin. We have done the coronary bone contouring, supraorbital bone reduction, then the rhinoplasty. See the lip reduction, Genioplasty, then the V-line-plasty. Here V-line-plasty means you are going to remove a bit of gonial angle and the masseter as well. This is one of my Switzerland patients. This is also multiple procedures has been done. Along with you can see brow lift has been done, lower blepharoplasty, rhinoplasty, mouth corner lift, then obviously the chin as well. You can see the chin, it's a broad chin, it's like a masculine chin. In the before, in the after, you can see the most point and it's around red chin. This is the isolated genioplasty. If you can see the before, we have in the combination of advancement genioplasty along with the submental liposuction. This is one more patient. Patient wanted, usually that's the ideal chin. The patient, I don't know, someone is skeptical that he wanted a V-line. So this is how. This is one more patient. Okay. This is again the isolated genioplasty. If you can see the before, the chin is more retruded, and if you can see there's a lot of submental fat. So the combination of advancement genioplasty and submental liposuction. This is again one of my trans patients. You can see the nose before, forehead, then the chin, then you can see the prominent masseter muscle and the gonial angle. This is on the table. We did the multiple procedures on that as well. This is again one more trans. For just for your information, we have done the hairline advancement, 40% reduction, supraorbital bone reduction, rhinoplasty, where we performed an osteotomy, diplasty, enoplasty, cheek implants. Then you can see the lower lip reduction and the V-line-plasty. That is advancement. If you can see the chin over there, it is U-shaped and retruded chin. In the post-op, you can see it is more pointed. You can see it's like a V. Yeah. This is again isolated genioplasty. All these are surgical, none of them are non-surgical. Advancement genioplasty. This is again advancement genioplasty. This is one of the patients. Again, we did a combination of procedures of rhinoplasty and genioplasty. If you can see her chin, it's so much masculine and it is not too much protruded outward. So we did a V-line-plasty for her. This is one of my trans. She has one missed trans in India. Yeah, I think 7 years back. This is how she came to me. Yeah, this is a transsexual woman. This is how now. Yeah. Now she's a brand ambassador for Election Commission of India, where she campaigns to vote in the elections. These are some of the trans people. I'm going to show you the technical videos. Someone can help me.